Hi everyone, welcome on in. I'll give everyone just a few minutes to join before we get started today. All right, so good afternoon. Thank you all so much for joining us. Let me pull up, make sure everything is good here. So this is the health situation, access, and inclusions of persons with disabilities in Lima, Peru, with Dr. Tina Reuter and Dr. Courtney Andrews. This is part of our Sparkman Center Global Health webinar series, and this stems from their work on a 2019 Sparkman Center pilot project. So just to introduce myself today, my name is Cameron Durham. I serve as the program coordinator in the Sparkman Center for Global Health. And before we get started, just have a few housekeeping things to go over. So today's session is in webinar format. It is being recorded and will be posted on the Sparkman Center YouTube following this. So if you'd like to rewatch it or share, please do. You can utilize the Q&A option at the bottom of the screen to ask questions. We will be saving some time at the end for questions, but you can type your questions in at any time during the webinar. Please also notice that closed captions will be available for this session. Like to thank the Office of Public Health Practice and the UAB Institute for Human Rights, who are co-sponsoring this event today with the Sparkman Center. And if anyone has any technical issues, please feel free to send to me or Katie Adams, who's also on the call, a message in the chat at any time. So now I'm going to hand it over to the Sparkman Center Deputy Director, Dr. Anna Helova. She's going to introduce today's presenters.
Hello, everybody. As Cameron said, I'm Anna Helova. I'm the Deputy Director of the Sparkman Center for Global Health and also an instructor in the Department of Health Policy and Organization at UAB School of Public Health. Today, it's my immense pleasure to welcome all of you and especially our two speakers, Dr. Tina Reuter and Dr. Courtney Andrews. So to just give you a very quick overview of their amazing accomplishments, Dr. Tina Reuter is the director of the UAB Institute for Human Rights and is also an associate professor in the Department of Political Science and Public Administration, as well as the Department of Anthropology. She is specializing in her practice and research on human rights, peace studies, and international politics. And she's doing that domestically as well as internationally. Her research focuses on human rights with particular emphasis on people who struggles of vulnerable and marginalized population, including people who are members of minorities, people with disabilities, refugees and migrants, women, children, LGBTQ community, and people dealing with the consequences of poverty. She studies how to use technology to improve access, inclusion, and participation of marginalized communities in society. In addition, she's an expert on ethnic conflict and peacemaking with a geographical focus on Europe and the Middle East. She published numerous publications in her field and also has been awarded multiple prizes and grants to expand her research and teaching. Dr. Courtney Andrews is a researcher at the Institute for Human Rights. She has a doctorate in medical anthropology, and her research focuses similarly on the intersection of culture and biology with special attention to health disparities in marginalized and vulnerable populations. Dr. Andrews also serves as a senior blog editor and community liaison at the Institute for Human Rights, and she's involved in several ongoing projects in the areas of gender violence, accessibility and inclusion for persons with disabilities, and refugee health. She also teaches in the Anthropology of Peace and Human Rights Master's Program at UAB. Today, they are both presenting on research that has been funded as a Sparkman Center pilot project in 2019. Due to COVID, some of their work was postponed to later time, and I think they will expand on that during the presentation. But today, we see some of the results of their work. Which is focused on the health situation, access, and inclusions of persons with disabilities in Lima, Peru. And with that, I'm giving the platform to Dr. Reuter and Dr. Andrews. Welcome and thank you.
Thank you.
All right. Thank you so much for the kind introduction and for inviting us to the seminar today. Let me share my screen. You all see this? Good. Okay, great. Let me maybe start with a quick outline. As I said, thank you so much to the Sparkman Center for funding this research. As Dr. Helova already said, this was funded in 2019. We were all ready and set to go in early 2020, had done all our background research, IRB and all of that stuff. And Dr. Andrews was actually scheduled to be on a plane the very week everything shut down. And so it was a little bit tricky because our primary partner in Peru decided over the course of the pandemic that they did not have the bandwidth to continue to work with us on this project. So there was a low moment in 2020 and 2021 where we weren't sure if we would even be able to continue. Good news is that at the beginning of, late 2019 and early 2020, we actually were able to find new partners on the project that have been amazing to work with, and it's been really fun to kind of continue the project. They also bring in a new expertise to the project, which has been immensely helpful to us. And we'll talk about this more as we go through our presentation. I want to spend some time on our approach and background. You heard that we're both from the Institute for Human Rights. I want to spend some time talking about this intersection of human rights and global health and how that kind of framed our whole project. I want to talk about the methods, and then Dr. Andrews will introduce the partners and the data collection of and the current status of our project. The data collection is ongoing, but we have some preliminary data that we can share. Well, let me again talk briefly about this connection between human rights and global health. When we think about human rights, the importance and respect for human rights has really increased over time. So we see mainstreaming of human rights into topics that weren't traditionally viewed through a human rights lens. For example, international development, business practices, environmental protection, security, technology, bureaucracy, health, and one big topic here is also health. Like the idea that we're not just looking at these global issues from a needs-based approach, but really from a rights-based approach, like a claim that we look at, for example, environmental degradation as a issue affecting humans and not only from an ecological perspective. So that's what we're talking about here. In the graph, you can see the number of human rights documents and how they have increased over time. The gray is Amnesty International, orange is Human Rights Watch and the US State Department. So this is like a trend that kind of started in the 1980s and continues to this day. Let me see here. So what does health have to do with human rights? Again, more and more aspects of health have been framed in a human rights context. Usually when we talk about health as a human right, we mean access to medical care, healthy life, sort of generally, broadly speaking, like the social determinants. So as you can see here, this is from the Committee on Economic, Social, and Cultural Rights. Talks about the underlying determinants of health and the connection to human rights. Like usually if we think about human rights, we kind of distinguish 3 types of human rights. The first one would be civil and political rights. These are things like voting, equal access, or equal representation before the law, those kinds of things. The second type are economic, social, and cultural rights. These are things like the right to work, the right to education, and among others, the right to health. And the third type of rights are usually sort of, they're not fully codified yet, so we don't have a treaty, an international treaty focusing on these rights, but these are kind of rights of the humanity as a whole. So the right to peace, for example, the right to a healthy environment, the right to humanitarian disaster relief would fall under this. And obviously the right to health kind of fits within this framework and is mostly codified, and I'll talk about this in just a second, in the context of economic, social, and cultural rights, which are usually in the international realm, which, you know, we're talking about here, right? Seen as a aspiration, as opposed to like a clear legal standing. And here are some of the things that fall under this. So right to health, safe drinking water, adequate sanitation, food, nutrition, housing, safe working conditions, education, gender equality, and non-discrimination. Usually when we look at the implementation of human rights in the health field, we see this, what we call the human rights-based approach. This kind of developed, this human rights-based approach to health developed in the context of the global HIV and AIDS crisis, again in the 1980s and 1990s. The WHO, the World Health Organization, has embraced this approach and really talks about the right to health and other health-related human rights, and how health-related policy making and programming are to be guided by human rights standards and principles. So again, we're moving away from just needs-based approaches, but really to rights-based approaches. And you can see here empowering rights holders, so the empowerment through the human rights language and claims. It also, like, there's some concrete linkages. Obviously, human rights violations adversely affect the community's health. These can be anything from, you know, what we see happening in Ukraine, for example, human rights violations during war, but that can also be, again, an inaccessible built environment that affects the community's health. Coercive public health policies, it can be human rights violations. We've talked a lot about this actually during the pandemic, right? Sort of this question, well, how far can public health measures go, and where do individual liberties and human rights start? A lot of really weird discussions, if I may say so, in the context of COVID-19, but like this question, sort of like where, you know, where public health policies start, where human rights violations begin, that's an important one. The question of human rights and public health, they reinforce each other, the principles, and the reinforce each other. Health equity obviously is a big important part of also human rights. It's more than mere rhetoric, and again linked to the social determinants of health, so we kind of embrace a broad view here. The principles are like human rights basically shape the way we focus on strategy, process, and outcome. And so these are some of the principles that need to be embraced for human rights-based approach: non-discrimination and equality, empowerment, agency by and for underrepresented groups, accountability and transparency, participation and inclusion, access, and then sort of this idea that all human rights are interdependent. So if we realize one human right, it might push forward others, and no human right is necessarily more important than another one. And we can talk about this some more in the context of our case study, but we really took this framework to kind of frame our study and the way we've approached it, especially with regards to the inclusion of people with disabilities in Lima. So now, why disability? And I know some of this might be familiar to you. When I talk about disability, a lot of times people, or the reactions I get is sort of like, well, you know, disability tends to be forgotten in the discussion of diversity, for example, and so on. So people with disabilities are the world's largest minority group. You can see here, according to the WHO World Bank, about 15% of every country's population is considered a person with disabilities. There's a wide range of disabilities, ranging from mobility impairment, like people in wheelchairs, to vision or hearing impairments, to sensory impairments, to learning disabilities, to developmental and intellectual disabilities, cognitive disabilities, and also psychosocial disabilities, including mental health disorders. So it's really broad. The likelihood that you know someone with a disability is really high. The likelihood that you will become disabled as you know, age and disability are correlated is very high. So disability truly impacts us all. It goes through all levels of socioeconomic status, all countries, and so on. It's also the most excluded group, especially if there is additional intersectionalities. So when we talk about, for example, poverty and disability, this is something we strongly found in the situation of Lima. So this idea of, you know, like poverty is both a reason for disability and a consequence of disability. And this invisibility of both the disability in policymaking and in regular life, right? The stigma attached with disability and the exclusion of people with disability really creates this very difficult and dire situation for people with disabilities around the world. Some of this has to do with the way we perceive disability. Disability today is viewed as a social construct. For a long time, we kind of embraced this so-called medical model with disability, where basically the problem is a person's impairment. So like the problem is that the person cannot walk, and what we can, or like, let's say if we're talking about a person with a mobility impairment. So what we need to do is to cure the person, like we need to teach them how to walk. And so it's medical doctors basically that, you know, set the diagnosis, and they are the experts, right, in changing. This is also the sort of the background of the special needs language, this idea that disability is not normal, right, quote unquote normal. This is not what disability rights activists or the disability community embraces today. Today we embrace mostly the social model, which recognizes that disability in a lot of ways is a social construct. So the issue is not the impairment of the person, but the way the society reacts to it, like the fact that, for example, that there aren't ramps for someone in a wheelchair, or that workplaces aren't accessible to people with developmental disabilities. So it really shifts this question, well, what's the problem, from the individual to the society? And it also has obviously policy implications. The human rights model is based on the social model of disability, but it really embraces the person with a disability as a person first. And sort of it talks about how, you know, a person with a disability is a full person, quote unquote, with all rights and all responsibilities and all right to a good life, basically. So based on the social model, again, puts the responsibility on the society, but embraces a person first approach. So this is one of the implications. You hear me say person with a disability, so we don't say the disabled or the, you know, some of the other less embraced word, or, you know, old-fashioned words like handicapped and so on, or the so we use person language first. It changes the way we define inclusion and who is in charge of creating inclusive policies. It changes the way people with disabilities see themselves. And obviously, as I mentioned, it also has policy implications. I really like this, and you might have seen this before, might have me showing this before, but again, you see here a person in a wheelchair wanting to vote, can't get to the voting booth because of the stairs. So the medical model would say he cannot vote because he's in a wheelchair, he's disabled, his impairment prevents him. The social model says he cannot vote because the stairs prevent him from reaching the ballot box. And I really like this one because it's sir, would you like me to vote on your behalf? This is how we traditionally have seen people with disabilities, basically, that in a paternalistic way, that, you know, kind of looking down on them and not considering them for full members of society. In a human rights context, it's really the Convention on the Rights of Persons with Disabilities that embraced this human rights model and kind of serves as the basis, at least legally, for parts of our project. Came about in 2006 with the purpose to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities. It's the fastest growing human rights treaty. 184 out of 193 countries around the world have signed and ratified the treaty. You can see here the Peru is a full party. The US only has signed it. The US has not a very good track record when it comes to international human rights treaties, and we can talk about this more if that's of interest, why it's mostly structural and, you know, some other reasons. But anyway, most of the world has either signed or ratified the treaty. It's really groundbreaking for a number of reasons. One is that it really embraces all three types of human rights. So the economic, social, and cultural rights, which are particularly important for people with disabilities, are embraced. It includes non-traditional actors traditionally in human rights. It's states, so like, you know, the United States, Peru, and so on, countries, basically the governments that are tasked with implementing human rights. And the CRPD, the Convention on the Rights of Persons with Disabilities, recognizes that there need to be other actors involved, and it gives a role specifically to disabled persons organizations. And we embrace this in our study by specifically including disabled persons organizations in the way we frame the study, based again on the CRPD. In mainstream disability, and again, Peru ratified it in 2007. It was actually the first Latin American country or South American country to do so. And it implemented, the way this usually happens in international law is you take an international convention and then you have a national law that corresponds with it. And so in 2012, they Peru basically enacted the general law on people with disabilities. And so some of those rights that, you know, frame our study are in there. Some of these rights in there is non-discrimination and reasonable accommodation. These are basically modifications and adjustments that don't impose a undue burden, but to really ensure that people with disabilities have the full enjoyment on the equal basis with others of their human rights. It includes participation and inclusion in society. That's important. Again, it's part of our study to kind of see how the at the accessibility level of the built environment actually impact social inclusion of people with disabilities, equality of opportunity, accessibility. This is a new human right. So the CRPD actually came out with new human rights, the right to accessibility, which includes, again, like being able to access physically, for example, a building or public transportation or information and communications technologies, websites, and so on. But interestingly enough, the right also includes the right for people with disabilities to monitor, to train stakeholders, and to participate in design of accessible solutions. So again, it's a comprehensive perspective. It also stresses equality between men and women, focuses on children's rights and other underserved groups like indigenous populations, for example. And it focuses also specifically on health, quality of life, and equity. So this is kind of the frame for our study, and I felt that it was important. I know it's a little bit broad, and again, I'm happy to answer any questions, but this is kind of the frame of mind within which we designed the specific case study, and within which we picked the specific methods and partners and data collection. So again, like framing this is sort of this idea of health equity on the one side and human rights on the other side for everyone, and to finding conditions for optimal health and human rights for all people, including people with disabilities. And again, in some ways, the two concepts, health equity and human rights, they reinforce each other. Because to achieve health equity, you have to value all individuals and populations equally. You have to recognize injustices, health disparities, and you have to rectify those. And you have to provide resources according to the need of these populations. For human rights implementation, you need action by governments and civil society actors. You need to be able to give people with disabilities a place at the table and have their voices heard. The two are not the same. Often we give underserved communities a place at the table, what we do not empower them to actually participate in the conversation. So often this is tokenism. So thinking about how do we effectively do this? And then obviously you need the laws, institutions and processes in place. And all of this, you know, at least on the surface, you have in Peru and in Lima. So for us, it was interesting to kind of look like, well, how does this actually play out at the grassroots level on the ground? Here are some of the barriers to achieving health equity and human rights for people with disabilities. Obviously, architectural. I think those are very clear, like the lack of access, the lack of ramps, the lack of curb cuts, the lack of accessible signage, and those kinds of things. Programmatic, attitudinal, this is a big one. Again, this idea that people with disabilities are less than, and then obviously the legal and institutional framework might be missing in order to achieve health equity and human rights. In an urban context, the idea is that everyone who lives in the city has the quote unquote right to the city, and that human rights need to be implemented in cities as well. So accessibility is a big part of that. Again, who has access, who is included and who is not, and why are the important topics here. Again, I can expand this. I didn't want to go too deeply into this line of thinking. It's part of a project, multiple projects, sort of this idea of, well, how do we implement human rights in an urban context? Obviously, urban health policy, and then again with disability specific focus, access and inclusion, and sort of merging these together. So here are the methods, and some of these methods came out of a similar project that we did here in Birmingham, in 4 Birmingham neighborhoods, in collaboration with Lakeshore Foundation, was funded by the Center for Community Health. And so we tested some of these methods here in Birmingham and then adjusted them accordingly based on what we found. So what we decided on was a mixed methods design, and embracing a community-based participatory approach, basically having people with disabilities involved in all parts of the process, including the design of the study, including the data collection and so on. It has a qualitative component, interviews, these are ongoing, and again, Dr. Andrews will talk about this, as well as Photovoice. Photovoice is a method, you might know it, in case you don't. It's kind of a cool method where you basically ask your target population, in this case, people with disabilities, to take pictures of items or locations and so on that express a particular topic or a particular focus. So in this case, we wanted to know how about the built environment, right? Like, and we want them to basically take pictures of inaccessibility or exclusion, or accessibility and inclusion, and and caption these photos. It's an excellent way for the community to express themselves through pictures. So especially if you work with underserved communities, expression in writing and so on, or even verbally can be an issue. So this is an opportunity for them to express themselves without much guidance from or input or leading in some ways by the researcher. We also have a quantitative component. It's a questionnaire. There's the neighborhood environment walkability scale, and we adapted this for a specific disability related purpose. We used this one in Birmingham as well, and it worked really well. And then finally, we have sort of spatial mapping methods, which are walk audits. We basically test the walkability of a particular urban environment. Walkability is, as you can see here, the definition, the extent to which the built environment is friendly to the presence of people living, shopping, visiting, enjoying, or spending time in an area. Usually the things we look for are things like sidewalks. What are they? Are they there? Do they have them? Like, are they in good shape? Land use, short blocks, narrow intersections, mixed use opportunities, so biking, traffic, like walking and so on. Aesthetics, so are important. Lighting is important, and then the presence of green spaces, plazas, and open space. Again, so important to consider the land use, the network, like, can you go somewhere? Obviously it doesn't, it's walkable, it doesn't help walkability if there's a sidewalk, but it doesn't go anywhere. Safety and access, and then obviously again, site design, is it inviting? Do you feel safe? Yeah, and I'm gonna end here because we included the social ecological model of health, the kind of look at walkability from all different types of levels, and from public policy to individuals. And I'm going to stop here and give the word to my partner in crime, Dr. Courtney Andrews, who will tell us about the partners and the data collection. Thank you.
Yes. Okay. Thank you, Dr. Reuter. So yeah, as she mentioned, I was finally able to get down to Lima after our project got kind of derailed for a couple of years due to the pandemic, and also to our previous partners pulling out. We were lucky enough. Is everything good? Something weird happened.
You're good now. Yeah.
Okay. So we were lucky enough to find new partners. We got connected with this guy named Jaime Huerta, who is from Lima. He works in the Department of Architecture and Design at the Universidad Privada del Norte. in Lima. He is a person with mobility impairment. He's a wheelchair user. So, but he has been very active in policy changes around, access and inclusion for people with disabilities in Peru. He's been very involved in advocacy and a prominent figure in this space. So we were lucky enough to get connected with him. He put us in touch with the dean of the department and a few professors. So I went down essentially to meet with them. Derek Dang, who is a student at UAB, he's with the Minority Health Research Training Program. He went down with me, and he's actually still there. So he's kind of carrying out the data collection over a period of like 3 months. So we went down together. Tina, if you want to go ahead to the next slide. These are some pictures of our team. You can see Jaime in the wheelchair in there. These are some of the students that they have chosen to carry out the data collection. So we have 3 students for each of the neighborhoods. I'm not sure Dr. Reuter mentioned this, but we're doing sort of a comparative study of 3 different neighborhoods in Lima. Miraflores, which is the more affluent commercial neighborhood, and then Lince, which is more residential, and Los Olivos, which is much lower on the socioeconomic status scale. And so we have 3 students designated for each of the neighborhoods to do the walk audits and collect the survey data. So we did, you can see here, Derek and Jaime doing a virtual training for the students, where they talked a lot about kind of what Dr. Reuter just went over, the theory behind this, the approach that we're using, what to look for specifically in the walk audits. And then we went out and actually did kind of a practice walk audit, where we went into each of the neighborhoods. We designated like a 10-block area to look at in all 3 of the neighborhoods that were sort of mixed use. So, we wanted to include things like grocery stores, disability organizations, if they had any, kind of parks or doctor's offices, like, all kinds of different, sort of things that people might, need to get to on a daily basis. We also met with the president of Fundades, which is a disability organization in Peru that's very active in this space. They're being very helpful to us with the recruitment of participants for the study. We did an interview with UPN, and I mentioned that just because this is clearly something that they're, very excited about. They're happy to be collaborating with us on this, and they're promoting it at their university. So that partnership is going really well. We're very fortunate to have that. We also met with some mayors and people from the municipalities that are responsible for like finding people with disabilities, registering them for services and preferential access in certain situations. Okay, we can keep going. I thought I would talk a little bit about the 3 different neighborhoods that we chose to look at for our study. So this is Miraflores, as I mentioned. This is the more affluent neighborhood. It is very commercial, lots of hotels, businesses. You can see from these pictures that Miraflores really gets a lot of things right. So, it is a very busy area, but it has really implemented a lot of the kind of standards of accessibility. You can see, ramps, changes in the texture of the sidewalk, a bike lane, narrow intersections that allow for people to cross these busy streets. There's the traffic lights are like, it's well lit. They have sound so that people who are hard of hearing can hear, the different signals. So these are some pictures of things that they do well. And then if you could go to the next slide, I think I have some photos of some impediments or barriers. You can see like this tree here in this picture on the left is sort of, you know, blocking, you know, somebody could just bonk into that pretty easily. You can see actually this picture of Jaime trying to cross the road, but there's a ramp, but it's it's not continuous with the ramp on the other side of the street. So you have to kind of go into traffic a little bit. There's a lot of construction going on always. It's not always, you know, marked off in a way that would make it accessible for a person in a wheelchair or a person with some other kind of disability to navigate around. So that's kind of something that is not, you know, considered when they set up these kind of safety precautions around the construction. You can see that a lot of times people will park cars on the sidewalk, making them inaccessible. And then there's also this picture here of this ramp going into a store, and I don't know if you can tell from the picture, but it's very steep. Like it's someone, you know, using a wheelchair, really, it's basically just a stair. Like it's kind of non-functional. So those are just some pictures of different things that I noticed in Miraflores. And now we can move on to Lince, which is the more residential area. It's much quieter, less congested. There's a lot of green space, like a lot of thought has gone into sort of the design of the sidewalks. Like there's a lot of tree cover and shade. It's very pretty and clean. But there are some problems. You know, here we were crossing this street, and there was really just no way to cross it safely at all. We were kind of in traffic, you know, and Jaime was having his assistant push him in the chair, you know, kind of through this busy intersection. And it was, you know, that's a barrier, that's a challenge, because it's really not a very safe situation. You can see again, you know, construction situations, but then there's also a really lovely park that, as far as I could tell, was pretty much accessible throughout. So that's Lince. And then actually for Los Olivos, this is a little video that I took. You can kind of see I wanted to show this because this is kind of this is our route. It takes you through the 10 blocks that we're looking at here, and it kind of stops at these different points to show you pictures. So this is as I mentioned, much lower socioeconomically, a lot more barriers, obstacles, impediments. As far as I could tell, you know, as I was talking to our collaborators about this as we were walking around, of course, people with disabilities live in these areas, but they are pretty much bound to their homes because it is very inaccessible. If there are any kind of impairments, like it's really difficult to get, you know, to a hospital, to a grocery store, to church, anything like that. It would require a lot of assistance and effort. So a huge difference between the three neighborhoods. So it'll be interesting to see what we get back with the data from that. So I kind of wanted to go over just quickly a little bit about where we are in the data collection. Derek has done about 30 interviews so far, 24 interviews with people with a disability that live in Lima. So not necessarily in these three neighborhoods, but in Lima proper. He's also interviewed 6 public officials or people who work at NGOs that provide services for people with disabilities. So we wanted to get that perspective as well from more of an advocacy or a service standpoint. And we have 6 different districts represented in the interviews so far. So I'm going to go over some of these preliminary themes or findings. So yeah, we can start if you want to go to the next one. Yeah, so when we're talking about public transportation, this is something that people often mention as one of the major obstacles or challenges for people with disabilities, is that there's really a lack of accessibility on public transportation. These little taxis or buses are very ubiquitous in Lima, but they're not accessible at all for a person, you know, in a wheelchair or something like that. Taxis, sometimes it's more, it's possible to get in a taxi, but they're very expensive. Obviously, it's expensive to have your own car, and it's just not a great city to drive in because it's very congested. Plus, they experience a lot of discrimination when they do try to access public transportation. People who need accommodations experience a lot of discrimination on the basis of their disability. Okay. So when we talk about the built environment, I show this picture again. There's a lot of issues. Lima does a lot of things really well, but I guess I should say that while Lima has been, or Peru has been very active, very supportive, very on board with the Convention on the Rights of Persons with Disabilities, and they've you know, have a lot of new policies and new laws devoted to improving access and inclusion for people with disabilities. There's a lot to be desired in the implementation. You know, some issues that we see with the built environment are the state of the sidewalks sometimes are not continuous, so that prevents kind of safe travel from point A to point B. Jaime had this saying that he would point out, you know, trampa no rampa, which means it's a trap, not a ramp. So something like this you can see in the picture is he would call a trap. And there, you know, many examples of that throughout. There are, you know, not many accommodations in public space times, or if they are there, they're sometimes even the accommodations can be inaccessible for certain people. And then there's the problem of not having enough elevators or ramps in public and private spaces. So sometimes buildings and businesses are not accessible to people with particularly mobility impairments. Okay. And you can, if I'm running over, feel free to cut me off. I just wanted to get through as many of these as I could. Like I said, Lima's heavily trafficked. Some streets are really just uncrossable. You can see, you know, people trying to walk across this crosswalk in this picture, but the cars are just coming. There's a lot of petty crime. Certainly in Los Olivos, it, you know, was felt, you know, much more, people were, you know, holding on to their possessions more closely and being more vigilant about things like that. There's a, you know, a lot of just kind of driver insensitivity and recklessness as you're crossing the street. So, you know, that's something that certainly comes into play for everybody. And really, when we're talking about walkability, we're talking about, you know, how walkable a certain area is for everybody, but the challenges and the barriers, of course, are exacerbated for people that have disabilities. So safety is a big problem. Okay. So CONADIS is an organization that's responsible for registering people with disabilities, and it grants them free access to all public transportation. They get preferential line status in all public establishments. There are a few problems with it, though. The disabilities are sort of categorized by severity. And so there's kind of a hierarchy of people who are more deserving of these benefits and people who are less deserving. There's also like a very slow, tedious, bureaucratic process that you have to go through to get your card and to get these benefits. The pandemic, of course, has exacerbated that. There is an organization that assists with these processes, but it remains very difficult. And sometimes people who have disabilities, it's like, it's not even worth the trouble of trying to get this card because it doesn't really, there are costs to it in addition to whatever benefit it offers. So there is an effort to increase awareness for rights of people with disabilities on public transport. In Los Olivos, especially, but it remains a pretty big issue. So yes, okay. So with regulations for urban development, like I said, there's the laws and the policies on the books are, have really taken accessibility for people with disabilities into consideration. But there's kind of a lack of checks and balances that leave the implementation a bit lacking. One thing that I learned when I was there is that the taxes that people who live in these different residential areas pay, and the businesses as well, like most of that money goes to the district. And they can kind of do with it whatever they want. There's very little money or funding coming in from the federal government or the national government. And so the districts are sort of responsible for their own resource allocation. And in a place like Los Olivos, where you have, very few, much lower income in the first place and fewer people paying taxes, then you just have a lot fewer resources to kind of deal with some of these problems. And it is the districts, you can see from this picture, like things are very divided along these kind of class lines. Los Olivos, just seems like a totally different place than Miraflores or Lima. Like it's a totally different city. Okay. Yeah, and so we added a question just as we, considering the context of the study, we wanted to ask about the pandemic. This actually is something that came up a lot just anyway in the interviews before we even got to this question, but certainly it's increased precautions for public safety and increased isolation. It's reduced the density in public spaces, but it disproportionately affects people with disabilities. There were not any negative sentiments so far about masks or vaccines, although vaccine access has been a problem in Peru. I think pretty much every restaurant that I went in, every kind of mall or public space required that I show my vaccine card. So of course, for people that have not been able to get vaccinated, they're not allowed to participate and to be included in these spaces. So that is one problem, that's been a big consequence of the pandemic. Okay, and then I think I've sort of at the end here, other kind of sentiments and themes that have come up in the interviews, the lack of employment opportunities for people with disabilities, lack of assistance, both in terms of just people and also organizations that can help with that. So I just put in here some quotes. Living isn't difficult, but it's complicated. People are not looking at me as a human being. They look at me as a person who depends on a wheelchair, not at me. I wish there was a discussion. So there is a desire to be represented in these discussions about plans and issues that people have, to sort of decide how to allocate these resources. Which at the moment is sort of arbitrary and not well managed. Like as there's turnover with the mayors, then there's there's very little kind of carryover continuous work devoted to these things. And then there's a lot of stigma and shame regarding disability. So there's, this idea that it's a curse, that, these are people that don't deserve to be included in society. And so there's a lot of work to be done in that sort of social space as well on disability. So next steps, we're gonna, continue collecting the surveys from people in the 3 neighborhoods that we're studying. We're gonna ask a few people to participate in Photovoice, so kind of get an idea of what what walkability means to them and what issues there are with that. And then, we'll kind of analyze the data over the summer. And then, hopefully be able to present our findings in the fall. Thank you.
Thank you both so much. That was awesome. I didn't want to stop you because I was so interested. We still have a few more minutes for questions though. So there were a few submitted in the Q&A. So the first one, are there special issues related to pregnant and childbearing women with disabilities?
Are you is the question specifically with regards to the built environment or in general? I'm not sure.
Possibly, you can talk about both built environment and then maybe in general.
Well, I can tell you in general, in the CRPD, there's a focus on child and maternal health and access for children and women and other types of underserved communities. For this particular project, we didn't specifically focus on pregnant women, but we do know from context in other places that obviously access to maternity wards. A previous study actually in Peru, we looked at the need for a disability curriculum in the medical school. So this is kind of unrelated, but related, right? And it was very interesting to see the medical students' attitudes towards people with disabilities, which kind of really refocused the question of stigma and discrimination. It also, people with disabilities require a hospital companion, so basically someone who is with them at all times. And so accessibility continues to be a big problem, and empowerment as well, again, because of so much stigma is attached. I can't tell you specifically in Peru about with pregnant women. I don't know if Courtney has anything to add, but I know that, again, the stigma and the accessibility are a big problem.
Yeah, and I was just going to add, I mean, just pregnant women in general have a lot of the same issues with access as like a person using a wheelchair would have in Peru, right? If they're trying to navigate a stroller or something like that through the sidewalks. So that's, certainly a consideration for people, with that are pregnant or, with young children. And then also for older people who maybe move a little bit slower. Those are all kinds of, people that are, taken into consideration when we're looking at this walkability concept.
Mm-hmm. This other question kind of goes in with that a little bit. Can you talk more about how people with disabilities are affected by stigma and discrimination in this setting? But you kind of touched on that with your answer, but.
Yeah, so this is a huge problem. There is often people with disabilities are, hidden. It's often considered, like a curse, or something like that. And so this is something that prevents people from registering to get, the benefits that they're entitled, because of that stigma and shame, or just the family members not being willing to assist them in that process. And there is still, kind of a reliance on things like witchcraft and religion, and sort of superstitious factors when it comes to, how people care for and live with, disability or people in their lives with disability. So that's a big problem. And there's a lot of discrimination that comes with that in pretty much every aspect of public life. There's, even when people have the registration or the ability to stand in like the preferential line in a public space, they often won't do it just because they get, sneers or they're treated poorly in that situation. And so that's what I was saying, like sometimes even the benefits just aren't worth it to people because of the way that they're treated.
Right. I know it's 1 right now, but we just have one more question if you guys don't mind hanging on just a few extra minutes. So this one is more about your methodology in your research. So it's what were your inclusion methodology to ensure folks with disabilities were involved in all aspects of the project design and implementation?
So hey, first of all, hi Nick. Good to see you here. We miss you. Nick was with us in the beginning when we sort of crafted all this, and he was there when we did the Birmingham study. So so the interview, the questionnaire, all of it was originally designed in collaboration with Lakeshore Foundation. So people with disabilities were at the front and center in the design of the data collection instruments. It was really important to us that their concerns were mostly addressed. Like we obviously had the literature and this tested scale and all of that, but we wanted to make sure that the questions represented the ones that that matter most to people with disabilities and especially mobility impairments. When we used those data collection instruments for the Peruvian context, we got in touch with Peruvian disabled persons organizations and had them review the data collection instruments, including Jaime, who was front and center in reviewing and making sure that they represent what types of questions are appropriate for people with disabilities and also represent the needs. So I would say 2 things. 1 is a really strong relationship with the community. And then 2 is to really engage them. I know the process is back and forth and it takes longer that way, but we feel really strongly because of this, our human rights background that we want to use the work that we do not only to empower people, but also to include them and give them a voice. So thank you so much.
And I would just add that so far, like in our interviews, at least, we have a range of disabilities from people with like mobility impairments due to an accident or like poliovirus. This is a big problem. Cerebral palsy, people that have muscular dystrophy or have had a stroke or some kind of chronic illness. And then we have also had some people with visual impairments as well. So far in our study, we have, been able to get perspectives from, a range of different disabilities.
Right. Well, that's it for our time. I could keep going and ask you guys a million questions, I think, but hopefully in the fall, after you've done a little bit more research, maybe we can get a follow-up or something. But again, I want to echo what Dr. Teran said in the chat. She said, thanks for doing this important work. So I agree with her. And then thank you guys for your time today. We really appreciate it.
Thanks for having us and for funding our research. We appreciate you.
Have a good day, everyone.
Thanks. Bye, everyone.
Bye.